Hello, good afternoon, good evening, depending on where you live. My name is Dr. Chidi Ufundu, and I'm coming to us this evening to talk about a very important aspect of life. Now, you've had your baby and you had a cesarean section. So, a cesarean section is an interventional way of delivering your baby. And for some reasons, probably during pregnancy, you guys completely lack intimacy, which is pretty common in so many homes. So your partner is afraid to make love to you, but you've had your baby. And this issue about lovemaking keeps coming up. You keep wondering, oh, when is the right time to start lovemaking after a cesarean section, CS? So you're wondering, you've heard so many theories. Your partner is getting impatient. You're wondering if everything is going to be okay. And you just want to know. This will be the basis for today's discussion. So it's also going to be applicable to women that have their baby through the vagina. Remember, there are principally two routes you can have your baby: through the vagina or through cesarean section. Now, naturally, prior to the advent of modern practice, every singular pregnant woman is expected to have her baby through the vagina. But guess what? Prior to modern technology, there are so many women that died during childbirth. There are so many women that had, they were supposed to have twins or triplets, but because their body could not deliver the twins and triplets naturally, the only way the body is structured to handle babies is one baby at a time. So when you're having two babies, or when you have complications during your delivery, the possibility of the woman dying and the baby dying was very high. So thank God, with modern technology, with modern medicine, the advent of cesarean section started saving so many babies, started saving so many new mothers. So right now, no matter how complicated your pregnancy is, if we discover that your pregnancy is going to be, poorly, timed, or for whatever reason, we're going to have something that might happen to the baby or something that will happen to you, we'll take you in and we go for cesarean section. Now, you can have either emergency cesarean section or you can have planned or elective cesarean section. Now, the question of the right time to make love is very important. So there is no room to be shy or to be shameful. Just feel free, relax. When I'm done with my presentation, you're going to have an opportunity to ask all your questions. So please quickly settle in. I can see admin is in attendance, Tosin is in attendance, and other people in the clinic. Thank you so much. We are talking about the appropriate time to resume lovemaking. What are the 5 facts you should be conversant with? What are those preconditions? What are those things you should anticipate regarding lovemaking? That's what we're going to talk about, and I'm going to start. Number 1 factor we have to observe: anytime you've gone under the knife, so going under the knife means you went for surgery, you have to heal properly. Cesarean section is a major surgery. So what I mean by major surgery, we're going to put you to sleep most times. We're going to bring out your baby. How can we bring out your baby? We're going to cut the anterior abdominal wall. Then we are going to get into your womb. So we actually have 2 wounds, the one on your belly and the one on your womb. Now, for you to resume normal activity, including domestic chores and lovemaking, remember, lovemaking will require a lot of energy. You have to have healed properly. This is number 1 fact. So subsequent to your proper healing, you are not supposed to engage in lovemaking accurately. Now, frame for normal healing of cesarean surgery wound is 8 weeks. So you have to make sure meticulously you observe 8 weeks post cesarean section before you even begin to have conversation about lovemaking. Now, if you had your baby through the vagina, you might not likely go through 8 weeks. So the reason why you have to go through 8 weeks is to have adequate time for proper healing of the vaginal tissues and all the paraphernalia. So the cervix, the womb, and all those areas that participated in the birth of your baby. You have to give adequate time for healing. And the globally recommended time to observe before you start lovemaking is 8 weeks. Very important to observe this. Now, the reason why you have to observe 8 weeks is because if you engage in lovemaking prior to these 8 weeks, the possibility you will contribute to wound breakdown is high. The possibility you might predispose the woman to infection is high. The possibility the woman might still be bleeding is high. The possibility the nature of the cervix, which ordinarily should come back to its original shape, the nature of your womb is still going through a lot of recovery processes. So if you begin your lovemaking before 8 weeks, you are not helping your body to heal properly. So this is number one fact. Observe appropriately 8 weeks. You have to plan towards this. You have to go for your surgical post appointment. So anytime you have a surgery, you have to go for checkup. We have to make sure you're healing properly. We have to make sure you don't have wound breakdown. We have to make sure you don't have an infected wound. Then once we certify you have been healed properly, both from the outside to the inside, then we can gradually give you a go ahead to start having conversation after this particular process. So acutely after having CS, sex is the last thing on your mind. You must allow your body to recover properly. Now, if you had complicated CS, there are some women that will have straightforward cesarean section delivery, no complication. If you have a complicated CS means you might have excessive bleeding, or we might have damaged some tissues, or you caught an infection, then you need more than 8 weeks. This is another fact. You need extra 2, 3, 4 weeks to even begin the conversation about lovemaking. So the 8 weeks given is stipulated for uncomplicated cesarean section. If your wound got infected, or if we encountered a couple of complications after CS, you started having fever, you started having signs you might have infection, we admitted you in the hospital, or you have high blood pressure, or you had any complication, you are gonna require more time before you begin the act of love making. Now, it's okay to nurture the idea of making love. Women are wired differently. Women have different levels of libido. There are actually some women that might derive more libido when they are in pain. So some women might prefer painful lovemaking. I'm just being real. There are some women that want to go hard. There are some women that want to go soft. So depending on your own pain pathway, what we are more interested in is not in the pleasure. We are interested in proper healing of your body. Now, the next fact simply says the love-making part, the first time after CS, will likely feel like you are making love for the first time. So what do I mean by that? Majority of women that had CS will experience painful sex, which we call dyspareunia, the first time. So when your body gets opened up, so many things will change, including your psychology, including the whole way your body is wired. So when you are planning to resume lovemaking, your body will be in a learning mode. Your vaginal tissues will not be fully relaxed. The whole pathway that will normally lead you to making love effectively will have a lot of processes to observe. So the likelihood that your first lovemaking after CS will be painful is very high. Majority of women will experience painful sex the first time after CS. Now, this is where your partner needs to come in. Why do you have this? Why the pain when you shortly had CS and you're planning to go back? That pain might not be related to that surgical wound you had. That pain might be related to a couple of changes, like breastfeeding, like fatigue, like postpartum depression, like even abuse, like not getting care. So depending on your mindset, depending on the level of care you have, depending on your preparedness, you might likely experience pain as part of a protective mechanism. So in our body, once our body senses that something will not favor us, our body is very, very protective. So your vaginal muscles, your vaginal tissues might actually go into survival mode. They will not be willing to participate in the act of lovemaking, leading to what we call dyspareunia, pain during lovemaking. It's called dyspareunia. Now, you need to understand that this is a temporal process. The role your partner can play in initiating lovemaking, if you guys are past the 8 weeks, is to go easy. So there will be a lot of foreplay. There will be a lot of extra penile sex. There are so many other ways you can have lovemaking without putting the penis inside the vagina. So it's gonna entail a lot of tender loving care, a lot of going easy, because this woman is very sensitive. This is not the time to be very acrobatic. This is not the time to be very experimental. You have to go at her pace. So the pain you will experience shortly after CS, when you resume lovemaking, it's completely normal. Majority of women will experience this. Over time, remember that perfect practice makes perfect. Over time, you're gonna get better. Over time, the pain will gradually go away. If you continue to have pain way down the lane, despite the period you're supposed to have recovered, then likelihood you might have had an infection, adhesion, or something went terribly wrong is there. What do we need? You go back for proper assessment. So number 3 fact remains that pain is going to be part of the recovery process. So your first lovemaking after going for CS will likely be painful. Is expected. Relax. Over time, it's going to get better. Now, number 4 fact. You as the woman, you have to be the driver of the lovemaking, not the man. So any sexual position that will put pressure on your surgical wound, you have to avoid it like a plague. So this is not the section of acrobatics. This is not the section of the man being in missionary position and he's bouncing off like an athletic person. No, you don't put pressure on the operative side. Now, matter of fact, as a way of recommendation, any lovemaking position that will take the pressure away from your anterior abdominal wall is what you will go for. So women can take charge. You can be on top. He can go from behind, but please don't put pressure on the operative side. The more you're putting pressure on the operative side, the more you're gonna delay the healing process. So lovemaking position must be very carefully thought about. No room for calisthenics. No room for rough and all those experimental things. No, go easy. Follow your partner's trend. This is not the arena for men. You must listen to your woman. You are supposed to follow her trend. If she tells you to go easy, go easy. This is not your thought. You have to do this because if you make mistakes, you're gonna cause her a lot of pain. That surgical wound can break down. We might likely send her back to the theater. We might likely begin to do a couple of things to save her. She might likely be bleeding on the inside. You might likely cause a lot of things which we can completely avoid. So please, if you finally resume lovemaking, go easy. Play like you're a learner. Pretend like you're a virgin. Whichever way you do, protect yourself. Be in charge. So the woman in this equation of lovemaking, after CS, you are in charge. You guide your partner exactly how you want it to be. Now, finally, because your body has gone through a couple of changes, because your vaginal tissues, your cervical tissues, your womb tissues, everybody is in a learning mode. It's not unusual to experience dryness. It's not unusual to experience low libido. So what do you need? A lot during that first phase of lovemaking. You have to bank on lubricants. Now, this is not the stage of wondering if it's spermicidal lubricants or not. Any good lubricant is okay. So you're not supposed to just limit yourself to Prisid. Any safe lubricant is okay. Why do you need the lubricant? Because the possibility that the vaginal tissue is not ready for lovemaking is very high. So the possibility the woman will be dry is very high. Even if you participate in 2 hours foreplay, most women will still be dry. So employ the services of very good user-friendly lubricants. So the vagina will be ready for the penis. Now remember, part of the conversation we will have with all women before they go home is what? Contraceptives. The possibility you can easily become pregnant within that 8 weeks is very high. And we don't want you to become pregnant until 18 months. 18 months. So if you have to resume lovemaking, contraceptive must be on the table. You cannot afford to be pregnant by 8 weeks post-delivery. It doesn't make sense. You cannot be taking care of 2 babies at the same time. You have to be well organized. So you have to insist. If you guys are not using non-barrier method, long-acting contraceptive, then make sure your partner is wearing condom effectively. Unfortunately, you don't announce lovemaking. Lovemaking can happen anytime. So I will personally advise that before you guys go home, talk to your doctor so you will be on reliable, long-acting contraceptive. You do not want to get pregnant, especially if you're younger than 35. The possibility you will easily become pregnant, even when your baby is not up to 2 months, is very high. So avoid pregnancy by all means possible. If you have to say no, say no. Because at the end of the day, it's the woman that will bear the brunt. It's not the man. Men do not get pregnant. It's you that will carry the baby. It's you that will take care of the newborn baby. So insist on doing the right things. Unfortunately, some women will not understand this. Some men will not understand this. You want your baby when you want your baby, but you're putting your life in danger. The joy of motherhood is to recover before having another baby. The joy of family is to space your kids so you get some time to recover. You are not a baby-making factory. So these 5 points must be on the table if you have to engage in lovemaking after cesarean section. So remember, observe 8 weeks after surgery. Understand your body is going to go through changes. So the first episode is going to be painful. Allow yourself to recover properly. Remember, you need a lot of lubricants, and you also have to think contraception. Very important. If you have all these at the back of your mind, you can relatively, gradually fit in your sexual life, and your family will run like a normal family again. Don't discountenance the role of sex in your relationship. Do not deny your partner lovemaking opportunity. There are several other ways of satisfying your partner, even when he's not going into the vagina. Don't give him a ticket to go outside and be using your newborn baby status as an excuse to go and cheat. Work together as a team. Find a common ground. There are so many ways you can achieve this. If you don't understand it, we can help you understand it better. Now, the clinic is open, and I'm happy we have a lot of time to interact. So admin is in the clinic, amazing admin, always on time. Tosin is in the clinic. Then I have Amara Ugudike in the clinic. So guys, the clinic is open now. Feel free to ask all your questions, okay? Many women experience reduced or non-existent libido after childbirth. At what point should a new mom seek medical help? Now, there are so many factors that need to come into play regarding your low libido. Like I told you, it's expected. When this woman is not getting care, when this woman is overwhelmed, when she has postpartum depression, when she has postpartum psychosis, when she's practically not sleeping, when nobody is helping her, what do you expect her libido to be? Her libido is going to drop. And remember, when she's breastfeeding, when her hormones are trying to recover back to normal, the hormone that will aid her for her libido to be up will be what? Down. So low libido is expected for virtually 99% of all new mothers will not even remember there is anything called a vagina, because most of them will be having very painful vagina. Either we have episiotomy, or you had a tear, or you had pain, or you had CS. So sex will not be on your mind. But guess what? Many women are wired differently. There are some women that are ready to make love the following day after delivering their baby. So people are wired differently. Now, you know you're normal. So if you're someone that ordinarily before now you have a lot of libido, you can make love with your partner anytime, but suddenly 2 months, 3 months, 4 months, it's not recovered, and you're struggling with the stress of being a new mother, then you need to seek help. Part of your seeking help will require counseling, how to have a balance. how your partner can come in, because women are not computers. Women need help. If you are not getting the help, if you are not getting the love, if you're not getting anything from your partner, and your partner is only answering husband and father, then you're going to struggle. Very important you get help. If you can get help, then you're going to be in a good place. So if this libido continues beyond 2 months, go and seek help. When you go for what we call puerperium, when you go for those appointments, your doctor will check your surgical wound, will also ask you about your problems. This is the time to relate to your doctor. Hey, doc, I don't know what's going on. My libido is no longer there. I can't even feel my clitoris and all that. Feel free to discuss your sexual struggles. It's part of your life. There is nothing spiritual about that. Now, don't give that man a license to misbehave. Now, as a man, you need to understand that this is not a room for you to be messing about. This is when to show real love. Like I told you, there are so many ways you can still achieve orgasm between the two of you without you going in. So you need to work with your woman. So if you go beyond 2 months, seek help. Very important. Okay? All right. Please keep asking your questions. Keep asking your questions. Does orgasm involve uterine contractions? 100%. The process of climax or orgasm in sex is a build-up. It involves a lot of pathways, a lot of chemicals, and all those chain reactions, which will lead to contractions in your womb through the process of release of oxytocin. So yes, the process of coming, which you guys call coming or climax or orgasm, involves contraction in the womb. Now, you might likely notice that even when your baby is breastfeeding, because oxytocin plays a role in the milk let down reflex, you will notice that when your baby is breastfeeding, you will be having some pain inside your womb, which will feel like you're contracting. It will feel like what we call Braxton Hicks, just like false labor. It's completely okay. It's the oxytocin that is helping to help the prolactin to release the milk that your baby will feed on. It's what's going on. It's completely normal. So the process of orgasm will lead to uterine contractions, 100%. And will achieving orgasm lead to bleeding restarting? Not necessarily. Not necessarily. If you heal properly, remember the process of bleeding has an anti-bleeding agent that will stop bleeding. If you spend 8 weeks after your surgery, you're not supposed to bleed. Any bleeding at that point means there was probably some bleeding disorder, or maybe you had some complications, or maybe you had some infective process going on. Now, here and there, before then, you might be having little spotting and lochia here and there, expected. But by the time you get to 8 weeks, it's expected that, what's that? Sorry about that, guys. So yes, it's part of the recovery process. But if you notice any bleeding by this time, couple of things. Some women will easily and quickly recover their normal cycle, especially if you're younger. So any spotting and bleeding about that period, it means your body is trying to come back. The contraction is there. The contraction won't necessarily lead to bleeding. Okay? All right. Okay. What causes the incision area to be itchy is expected. So there are a couple of cells on the surface of your belly which will react whenever we go there to conduct any surgery. Is expected. That itching is pretty much normal. You're not supposed to worry about that. We'll probably give you a couple of, try this oil here and there, and before you know it, you'll be fine. So itching in your surgical site is completely okay. It's expected. Anytime you breach any perimeter in the skin will react by leading to a couple of itches. It's just a way of your body protecting yourself. Okay? Is it possible for the incision area to open up if it's not properly taken care of? 100%. 100%. If that particular surgical site, it's not properly adhered together, it's not properly sutured, it's not properly cared for. If you have any infection, we have actually had women that their surgical wound broke down. We've had infected surgical wound. This is why you need to go to the best. You're not just supposed to go to any doctor that will open you up and create a lot of infection. So if you notice any pus coming out from the operative side, definitely you're going to have pain. But if about this 8 weeks, the pain that was supposed to be subsiding is still there or increasing, and you notice fever, or you notice redness, or you notice blood coming out from that particular surgical area, likely that wound is infected. We need to take you back. We need to do what we call womb cleaning. We need to remove all those dead tissues and see if we can initiate new proper healing. So anything that leads to poor healing of that wound will lead to likely infection. An infected wound will not heal properly. So if that wound is infected with bacteria, viral, or fungal, whatever, the healing is going to take long. Sometimes we might need to give you antibiotics to cover that. This is why you need to be careful. You see, when you stay a long time in the hospital, there are a couple of infections you can pick from the hospital. They are called nosocomial infections. So as soon as we are sure you are fully okay to go home, actually being at home might save you from picking infections than staying a long time in the hospital. Staying long time in the hospital might actually be a risk factor for a couple of people that have immune problem to picking any infection in the hospital. So you need to be careful. Once we are sure your wound is doing okay, you can take care of basics of wound healing, then you're good to go. Okay? So yes. All right. What advice do you have for male partners or women dealing with reduced sexual desire? This is where communication comes in. This is where TLC comes in. This is where love comes in. This is when you should actually understand. But if the woman is not communicating, most men will not understand it. So this is not just a case of, I don't want, I'm tired, I'm this. You have to talk about it. You have to talk about your needs. The man needs to understand that you need some time. And you have to help your woman walk through those times. So it all involves your communication. This is where your communication skill is important. Sex cannot run away. You will actually have all the sex you have in your life until you get tired. Remember, both of you are stuck to each other for better, for worse. So you have to find a middle ground. As the woman, like I told you, there are so many things you can do for your partner to satisfy your partner. As a fact, you can use your hand, you can use your mouth, you can use a lot of things. You can do so many things. I'm not supposed to teach you all that. You should have done this by now. So you have to love your partner. You have to understand that when she's not in the mood, it's your duty to walk her through that route. But if she's still not in the mood, don't go there by force. Keep on deliberating, keep on communicating, possibly go for counseling. So many women are boxed up when it comes to sex. So many women spiritualize sex. So many women don't have experience. So many women are pretty much robots when it comes to sex. What your mom told you is what you're practicing. So many women just have sex to have babies. So many women have removed the pleasure aspect of lovemaking and they have replaced it with only procreation. That's a problem. So sex is a mind thing. So you need to work with each other. As a male partner, you need to understand that you need to give your partner time. Then you as the female partner, you need to understand that your partner has a need. Your partner has a sexual need you have to satisfy. It's your duty to satisfy that. Look, I'm keeping it real. In as much as your vagina is in your body, but both of you must meet each other halfway. You don't want to create a lot of, friction that will warrant the guy to go outside and the guy will be using your pregnancy and your whatever as an excuse. You don't want to give him that visa to go and mess about. So this is where understanding and maturity comes in. There are so many women that have not made love to their partner for almost 2 years now. When you ask them, oh, I just had a baby and all that, that's not good. You don't have to do that. Okay? Now, this is something both of you must understand and talk about and understand the pathway of getting help. Okay? All right. Should one be worried about leg swelling after CS? You shouldn't just be worried. You should be rushing to the hospital immediately. You see, some women might continue to have preeclampsia after delivery. Normally, after pregnancy, there will be a lot of redistribution of fluid that accumulates in your body. Now, some women will continue to present with evidence of preeclampsia. So preeclampsia is hypertensive crisis that can happen in pregnancy, which will involve increase in your blood pressure, serum protein in your urine, and generalized body swelling. So if you suddenly notice that your leg is swelling, for a very long time, it's expected that after delivery, you have a couple of swelling here and there. But if about these 8 weeks, you notice that your leg is swollen, then run to your doctor. It's possible you might be having complications. So yes, you should be worried that you have some legs, especially if they are not uniform. If one leg is swollen and your other leg is not swollen, then we need to be very, very careful, especially if that swollen leg is coming with pain. Then we need to be worried. You need to go to the hospital immediately. Okay? Amazing question. Can CS scar ever go away? Well, it depends on who did it. Lately, we have micro-invasive, very sexy car. You wouldn't even know you had a baby. True. Gone are the days when they will construct a main road, a bypass, a river Niger in your belly. No. These days, bikini line incision, you wouldn't even know. So if it's done properly with minimal interruption in the skin, yes, some women wouldn't even know they had CS. So it depends on the method of the cesarean section they are using. And lately, thank God for modern technology. You know, some people wouldn't even know they had CS. Their belly will be pretty much good. Now, everything is all about your lifestyle. So if you keep adopting very healthy lifestyle, your body will generally over time come back to normal. Your belly is not going to be 100% flat belly and six pack and all that. But at least if you do the right things over time, it will gradually. Likelihood you might have striae here and there, stretch marks here and there. It's okay. It's the price of love. It's the price of having your baby. Completely okay. All right? Okay, guys. Exactly the 30th minute for this clinic. So thank you so much, COO. Amazing question you've asked. How long does it take to do CS? Pretty much about 1 hour. It will surprise you. Straightforward CS, pretty much about 1 hour, everything is done. Everything suturing and stuff. If it's straightforward, no complications, but the more complications and also the more medical issues we have, the more it might take more time. So in a very good facility, less than 1 hour is done. You suture you up and you're good. Now, most times the reason why they might spend more time in the theater is, a couple of other extra, helping hand, trying to fix one or a few things, trying to make sure you're okay before they bring you out. But the whole process is less than 1 hour and you're good. And CS is the simplest surgery you can do in medical practice. Very, very simple, straightforward. Okay? Thank you guys so much. I love the questions. Now, if today is the first time attending my clinic in YouTube, we normally run this clinic every Tuesdays. 6:30 p.m. Eastern Time, 11:30 p.m. Nigerian Time, and then Saturdays, 12 p.m. Eastern Time, which is 5 p.m. Nigerian Time. So the Tuesdays clinic is a little bit late for obvious reasons. We are on working hour. So that's about the time I will have time. But weekends, I come a little bit early. Now, if today is the first time attending my clinic, I love the fact that you came. Thank you so much. Please make sure you subscribe. Click on the subscription button, set your notifications to tell you when I come live every Tuesdays and Saturdays. Okay? But right now, just immediately, we're going to go to our Facebook. We're going to go to our Facebook group and page so we can talk to our community there. So every time I show up, I also give another 30 minutes on our community in Facebook page. So thank you for coming. Kenneth, thank you so much. Tosi, thank you so much. I see you guys in Facebook. Until I see you on Saturday, God bless you and bye-bye for now.